Hey guys, we're back to it here with exercise number 2 of 4 of our main core strengthening and core stabilizing exercises. Again, just to reiterate, what we're attempting to do is, well, what we are doing, not attempting, is we're actually going to take the pressure off of this disc. So most of the patients that come in to the office, they're suffering from lower back pain. That's a big percentage of our patients. And we want to take the pressure from the discs in that lower back and disperse that pressure through the muscles so the muscles can do their job, stabilize, hold the spine up, and we won't have nearly as much pain. What happens is, again, if we look at the disc in the lower back, we got a bone, disc, and then another bone, and there's the nerve. What happens over time is a lot of the patients, they come in here and they got a lot of compression in their disc, and their disc can bulge and push on out. And when that's happening, it's very painful. So we want to obviously decompress the spine, pull that pressure off of there. And equally important, we want to then strengthen the muscles surrounding the spine so we don't have that disc once again get the pressure and once again have the same symptoms. So today we're going to go over an exercise called bird dog. This is a really good stabilizing exercise for the core. So what we're going to do in this exercise here is we want to make sure our hands are over our shoulders, make sure our knees are over our hips, right? We don't want to be in too far or out way too far with our knees, and same thing with our hands. We don't want them too far away from our shoulders underneath and too close to our knees. So more or less, hands over the shoulders, knees over the hips. Okay? What we're going to do is very important, is the first thing that we're going to do in this exercise is we actually want to tighten up those core muscles. We want to get that nice and stable, nice and strong before we do anything. So I'm going to go ahead and tighten those up right now. The second thing that's important is we make sure that we breathe normally, right? We don't want to hold our breath. What happens is if we hold our breath when we're doing this, that's actually going to increase the pressure inside the spine, inside not only the front abdominal cavity, but in the posterior area of the spine as well. And that's going to put a lot of compression on the disc, which is the opposite of what we're trying to do. So again, we're in this position here. First thing is going to go ahead and tighten up those core muscles, get them nice and stable. I'm breathing normally, and then I'm going to take one foot in nice and easy, controlled manner, bring it back. Okay, and we don't want to have that foot down too low. We don't want to have a way up high or twisting one way or another. As best as we can, we want to have that fairly level, fairly parallel to the ground. During this motion, I'm also making sure that that glute muscle is very tight. Okay, so that's fully engaged. So right now, abdominals are fully engaged, glutes fully engaged, and I'm going to hold for about 5 to 10 seconds. I'm going to bring it on in, make sure I catch my breath, make sure I feel strong and stable. Again, tighten those abdominal muscles, normal breathing, and I'm going to bring that leg back. Okay, same thing. Trying to have it as level as I can. Okay, so it doesn't have to be perfect. If it's up a little bit or down a little bit, it's not the end of the world. But we don't want it way low or way high or way rotated. Okay. Again, normal breathing, abdominal muscles are nice and tight, making sure that that glute muscle is nice and tight. Okay. Typically, I'll do about 5 of these on either side with just the leg, and then I'll add in the arm. Don't have to do the arm. It just makes it a little bit more challenging. So what you're going to do with the arm is we're going to do opposite leg, opposite arm. It comes straight on out in this position. We're holding here nice and stable. Again, 5 to 10 seconds, making sure I'm breathing, back on in, and then opposites. Okay? What you're going to do is you're going to do typically one set. You'll do 5 to 10 repetitions, right? 10 repetitions, 5 to 10 second holds. Okay? If you do 10 on each side of this exercise, and you even just hold them 5 seconds, it's not the easiest exercise. If you're going through this and it seems really easy, then probably a couple things are happening. Number one, you're not contracting the muscles as much as you could be within the abdominal cavity, or you're not tightening the glute muscle as much. So when you're going to extension, that glute muscle is not tight enough. So if that's the case, it's a great opportunity to improve this. Go ahead and relook at how you're doing it. Make sure you're smooth and controlled. Tighten the abdominal muscles. Make sure you're breathing normally, and make sure those glutes are fully engaged. This does make a difference. Again, This isn't going to be, you're not going to do these exercises once or twice and your low back pain is going to go. This is going to take some time, typically at least a couple of weeks to a couple of months of doing these fairly consistently. So again, 1 time per day, you're going to do 5 to 10 repetitions and 5 to 10 second holds, okay? And the only time to really probably not do this is within the first 1 hour of waking up, because the first 1 hour of waking up, the joints are a little stiff, a little tight, and we want to have the body a little bit more loose and a little bit warmed up, okay? And then also a reminder, we want to train abdominal muscles before we start to work out with heavy weights or even do a high intensity workout. Get a little sweat going, get 5 or 10 minute warm up on a piece of equipment or a jog or what have you. Then do the core muscle strengthening to stabilize that spine so the muscles are activated, so all the pressure is not going back into the disc right through here, which is where we don't want, but they're dispersed through the muscles. All right, give that a shot. Let me know. Message me with any questions you have, and I'll be happy to respond.